Let me make the point that I do think that although the consumer market is a concept of some utility in healthcare, it's a long way from being a complete answer. If you've had a stroke and you don't even know where you are not a good consumer. If you are elderly and have 7 conditions going on, you are not a good consumer. This isn't like buying a bicycle where you say, I like that, I know how it works, here's how much it costs. I challenge anybody in this room to explain to me what's in their health insurance right now. If you want to have a market, you've got to have a product and you've got to have a price. I don't think anybody really understands what the product is. They kind of buy what other people go. They go by, you know, what has a good reputation and stuff like that. And nothing has a better reputation than Medicare. And then they go by price. And here's where I get to my question. 2 members of my family recently had minor health episodes. One of them spent a night in the hospital for observation. The other one just had to have a bunch of tests. I don't have the billing sheet in front of me right now, but my recollection is that each billing sheet basically said, here are the charges, here's what we paid, here's what you owe. And for one, rough numbers, it was like $10,800. That was for the overnight in the hospital. What we paid was about $1,800, and what I owed was about $40. The other one was about a little under $4,000. What we paid was about $468, and what I owed was $20. So,
Senator, what do you mean by what you owed and what you paid? I didn't quite
well, here's my point.
Yeah.
The first number, the 10,000 plus or the 4,000, was what the bill was. The insurance company paid 15% of it, and I had a little extra 1 or 2% that I was supposed to pay for myself. Where'd the rest of it go? What's the price? We run a healthcare system in which nothing has a price. As best I can tell, you bring your price with you depending on who you are. If you're broke and have no insurance, they will hunt you down for that $10,800. If you have insurance, they'll take the $1,800 from your insurance company and say, super deal, you owe me $49, we're all done. And depending on what kind of insurance you have, that number moves around. But how do you get real market pricing into this system? Would it make sense to pick out a few things, 1 or 2 durable medical equipment pieces, 1 or 2 tests, 1 or 2 pharmaceuticals, and say, look, let's just see how it works if you put a real price on it where one person doesn't have to pay 10 times as much for the same thing as another person does, and try to narrow that. What's your, how do you make this, how do you try to put a price into this cloud of nonsense that is now the pricing system in healthcare?
Well, you've articulated the problem very well, but I think I would start with what some states, some hospital associations, and some insurers are doing, and that is basically allowing you to test ahead of time. I'm going to have a baby, I'm going to have knee surgery, I'm going to have whatever. What is this going to cost me given my condition? And how might it vary across the different providers that I have access to? That's how you make a market work. Those tools do exist, sir. You know, you invented some in Rhode Island, but the truth is they're not everywhere.
And you have
the
to
truth
be able
is
to,
they are doing
you have to be able to bundle costs together in order to do that, and that's the developing
And so some insurers,
strategy.
some plans. What ought to happen as we roll out these exchanges is that kind of cost calculator should be available on a broader basis. Again, some states are doing it, and that would be a really smart thing.
So bundling is a key step.
Bundling is a good thing, and letting consumers know ahead of time what different packages are going to enable you to do. And you can do that at the point of purchasing insurance as well. You, in particular, when you sign up for a Medicare program, you know what drugs you're on, you know what drugs Dr. Patel has prescribed. You look and see which of these packages are better for me. We could do that. It does require information systems that are essentially connected and well-developed, and it's not in any way
That's
uniform.
a whole other saga, and my time has just expired. But let me thank you, Chairman, for holding this hearing. When we're burning 18% of our GDP on healthcare, and the least efficient country in the world that's competitive with us is only burning 12, we have a healthcare cost problem, and to masquerade it as a Medicare problem, I think disserves the problem that we face and disserves the American public.
Thank you.